the whole field got invaded by people who have nowhere near the intelligence or the wisdom to be doing what they're doing. The sort of naive social worker types who are ideology-addled to the nth degree. And I had a colleague at Harvard, Richard McNalley, who was very concerned about the instilling of false memories by foolish therapists. That started to become a real issue in the 1990s. And, and it was all a consequence of therapists who had one theory about pathology, insisting that it explained absolutely everything in the universe of moral striving, let's say. And that weakness that was obvious there has just magnified itself tremendously. So this is my fear and my shame, for that matter.
Sure. So in researching bad therapy, I first of all, I started out with a totally different hypothesis. I knew that these kids were getting more mental health intervention than any generation prior, the rising generation. I knew that they were getting more diagnosis and more psych meds and more therapeutic intervention in schools. But I still didn't think therapy was necessarily the problem, because while 40% of them were getting therapy, it still wasn't a majority. And yet we'd seen their mental health fall apart. We knew that the rise in therapy and therapeutic intervention was somehow coinciding with worse mental health. That of course shouldn't be the case. Like with breast cancer, more access, more treatment, better treatment and more access to it has seen, rates of death from breast cancer plummet. And that's what we would expect to see with mental health. And we're not seeing that. But I still thought, it was possibly just the way kids were being raised. Maybe they were being raised differently, or perhaps it was just a smartphone. And then I began to look into what the iatrogenic effects of therapy are. What are the ways that therapy can hurt you? And there's a literature on this. Unfortunately, it's not a literature most therapists want to acknowledge. They want to claim that therapy has this amazing power to heal, but that it can never hurt. And of course, there's no treatment for which that's true. Anything, Tylenol can damage your liver. Anything that can help can also harm. And so I began to look into, were these kids getting a lot more therapy? And not only were the harms we were seeing in this generation, the lack of agency, the listlessness, the family alienation, the anxiety, depression, all effects of, iatrogenic effects of therapy, harmful effects of bad therapy. But we were seeing this, it was being applied not only from actual therapists, but all over the schools. And from parents. Parents were having therapists guide their parenting, and schools were having therapists do trauma-informed care with all the kids. So I started realizing that these kids were getting a lot more psychological intervention than I realized, and that it was bad.
Obviously, you're not convinced that that's the case, and you're implying at least, or maybe making a direct accusation, that there's something about the therapeutic industry per se that's actually making mental health worse. Now, Greg Lukianoff certainly is making that case, and I would say it's a case that Jonathan Haidt is probably, what would you say? He's supportive of that implication. Why did you come to the conclusion that the enterprise is doing more harm than good?
Well, because they're not treating the sick, they're treating the well. So we know that the risk of iatrogenesis, of the healer introducing a harm, is greatest when you're treating people who don't need the treatment to begin with. Okay. So we know that if you're gushing blood, going to an ER is an important thing to do. It's necessary. It's life-saving. But if you have a small bruise, you're much more at risk of getting an infection from the ER, picking up, a MRSA or some other bacteria from an emergency room visit than you are than you stand to benefit. And the same is true with preventive care. We shifted from treating kids and treating adolescents with severe mental health problems to the idea that everyone should have therapy.